Good morning, everybody. I'm Nichamon Lumrod, a master student from Faculty of Public Health, Mahidol University, Bangkok, Thailand. Today, I'm going to talk about a study on the effect of a capacity building program on health literacy in smoking cessation for village health volunteers. First of all, let me give you a brief background of this study. Smoking is a major cause of death of population around the world. Smoking affects not only the health of individuals but also family and communities. Smoking, stroke is the tubercle-related illness that is the leading cause of death among Thai people. In Thailand, 19% of Thai population are current smokers. In Thailand, the smoking cessation clinic in the hospital and quick line are main smoking cessation clinic provided for smokers. However, people who are not sick and do not want to quit smoking do not come to the service. Therefore, community-based smoking cessation is now the new strategy to help quit smoking, especially who live in the rural area to stop smoking. Village health volunteers are important workforce in helping people to quit smoking because they are close to the people and understand the community context. However, village health volunteers still lack of confidence in helping people to quit smoking because they do not have knowledge and experience related to smoking cessation. Previous study found that only 28% of village health volunteers had health literacy related to the reason for smoking cessation. The research objective of this study was to examine the effect of a capacity building program on health literacy in smoking cessation for village health volunteers. The health literacy concept by the Health Education Division of Thailand used health literacy into 6 different skills: cognitive skill, access skill, communication skill, self-management, media literacy skill, and decision skill. And the health literacy of NADBEAM can be examined into 3 levels: functional health literacy, interactive health literacy, and critical health literacy. The research methodology of this study is the research was a quasi-experimental design with 2 group p-test protest design. Population was village health volunteers of the 11 health promoting hospitals in a suburban district located in the central region of Thailand. 2 out of the 11 health promoting hospitals were randomly selected. The sample size was calculated to prevent the loss of sample. The sample in experimental group and the comparison group were 30 cases each. Intervention is a capacity building program on health literacy in smoking cessation for village health volunteers. Intervention for week have 2 sessions and follow up 2 weeks after the end of the activity. The first session in the first week used 3 hours have pre-test and health education by using teaching technique, teaching about the how to access information by searching and selecting information. Discussion of situation about smoking problem in community to develop health literacy in smoking cessation. The second section in the second to fourth week, village health volunteers set a goal and plan for smoking cessation and educating people through community broadcasting system. Home visit of smokers to motivate smoking cessation and post-test 2-week follow-up after the end of the activity. While the comparison group receive the education material on how to help people to quit smoking. Self-administered questionnaire was the research instrument used in this study. It consists of personal information and skill measuring health literacy in smoking cessation. Health literacy in smoking cessation consists of cognitive skill of smoking cessation, access skill of smoking cessation, communication skill of smoking cessation, self-management, media literacy skill, and decision skill. Have the reliability value of more than 0.7. Let's look at the result of this study. Most of the subjects, primary school, and work as farmer. Most of the experimental group had work experience average of 14 years, whereas the comparison group had average of work experience of 10 years. Most of them had no training in smoking cessation in the past 1 year. There was no significant difference in characteristics between two group tests by chi-square test and independent t-test. This slide shows that mean score of health literacy in smoking cessation of the experimental group, mean score at the post-test and follow-up were significantly higher than the p-test and that of the comparison group. This could be result of activity in the program that enable village health volunteers to develop health literacy in smoking cessation based on the following 6 components. Mean score of cognitive skill of smoking cessation of the experimental group, mean score at the post-test and follow-up were significantly higher than the p-test and that of the comparison group. This could be result activity to health education about smoking cessation and self-study activity from receiving a handbook of quit smoking for village health volunteers. Mean score of access skill of smoking cessation of experimental group, mean score at the post-test and follow-up were significantly higher than the p-test and that of the comparison group. This could be result of activity to increase access information skill by searching and selecting information from various sources and information searching activity from situation about smoking problem in community. mean score of communication skill of smoking cessation of the experimental group. Mean score at the post-test and follow-up were significantly higher than the p-test and that of the comparison group. This could be a result of activity to sharing knowledge of situation about smoking problem in community and activity to presenting discussion of situation about smoking problem in community, activity to educating people through community broadcasting system and home visit of smokers to motivate smoking cessation, mean score of self-management of experimental group, mean score at the post-test and follow-up were significantly higher than the p-test and that of the comparison group. This could be a result of activity to assigning village health volunteers to learn by themselves or search information about smoking cessation from various sources, and activity to set a goal and plan for smoking cessation. Mean score of media literacy skill of the experimental group, mean score at the post-test and follow-up were significantly higher than the p-test and that of the comparison group. This could be result of activity to teaching how to check validity to think and analyze smoking media that present both true and untrue information. Mean score of this decision skill of the experimental group, mean score at the post-test were significantly higher than the p-test and that of the comparison group, but follow-up not significantly with p-test and the comparison group. Based on the analysis of questions about decision making, it was found that the experimental group would selected an answer that they thought it could help with smoking by themselves by the time that the researcher did not participate in activity because they felt unconfident that they could not do the same way they did the experimental activity that the researcher joined the activity. Therefore, they selected an answer that they thought they could practice easily by their own. Result of this study suggest that Ministry of Public Health should formulate a policy to evaluate health literacy of village health volunteers and a training policy for development health literacy of village health volunteers. Activity to develop capability of village health volunteers should be focused on coaching, problem solving, guidance, and reflection. Enable village health volunteers to increase their health literacy in smoking cessation. Recommendation for future research. The first, health literacy in smoking cessation regarding the discussion making should be developed by using the leader of village health volunteers. The second, effect of health literacy on smoking cessation service should be studied. The third, a long-term follow-up should be conducted to examine the susceptibility of health literacy in smoking cessation. Before I end my presentation, I would like to thank Tobacco Control Research and Knowledge Management Center for the funding support on this study, and also thank Kyoto University for approving me the scholarship to participate in this conference. Thank you.